This episode is for people who have health insurance in their home country or who have a national health service and feel that they don't need to have insurance here in Thailand. I wanted to look at the risks that you're facing and why you need to get a health insurance plan in place here in Thailand. On an almost daily basis, I speak to people who pass on health insurance purely because they feel that if they get sick or if they have a serious accident, they can just jump on a plane back to their home country to make use of the provisions they have in place there. So there are a multitude of health conditions where you cannot get on an aeroplane. I'm just going to have a look at some of them now. They include infectious diseases, such as infectious diarrhea, flus, heart attacks and strokes. This is a real big one because the costs associated with getting somebody into a stable situation when they've had a heart attack or they've had a stroke are potentially huge. So you really need to think about that. And this is a common area of concern for a lot of people with high cholesterol, high blood pressure, which is increasingly common. Infections of the sinuses, the ears and the nose, again, something quite minor, but if it develops into a more serious condition, you will not be able to fly. Angina or chest pain. People who've had recent surgery for bone fractures. So this is tied in potentially with accident expenses. So if you have an accident, if you're in a motorbike crash and you break some bones, you need to stay in Thailand until you're healed because you cannot fly with fractures. So these are just a few health conditions where you will not be able to fly. So what do you need in order to protect yourself whilst you're here in Thailand? The answer is simple. You just need an inpatient plan which is going to cover the most serious expenses in the event of being admitted into the hospital. You can combine that with a deductible to reduce the overall premium, and some providers even have options for things like copay and restricted networks in order to reduce the premium as much as possible. This will leave you well protected while you're here, and it will cover expenses to get you in a situation where you're fit to fly to be able to go back to your home country and take advantage of the cover you have there or your national health service.